Choking can happen to anyone, anywhere, and at any time. In a severe case, it can be absolutely life-threatening. There are far too many choking deaths every year. Ask any emergency consultant. The feeling of panic and distress that a severe attack causes, you would not wish on anyone. There are up to 4 minutes where relatively little brain damage has occurred. But after those 4 minutes, the situation becomes more and more serious as those vital seconds tick away. Most people have experienced the fear of watching a loved one choke, and although most cases end in the obstruction being cleared, far too many young, old, and vulnerable people have lost their lives to this common medical emergency. In fact, choking is the leading cause of death in children. If trained in first aid, anyone who witnesses a choking emergency will have been taught traditional methods of extracting the foreign body which blocks the patient's airway, such as the Heimlich maneuver, which is now called abdominal thrusts. Although such techniques can be highly effective, if ineffective, the only course of action is to await an emergency response. Ambulance response times have dropped in recent years, which puts more and more of us at risk. Knowing that it only takes 4 minutes for brain damage to possibly occur in someone choking, this is a costly wait. Experts at Dechoker LLC are only too aware of these facts, and as a result have worked tirelessly over the last few years to research and bring to production the Dechoker.
We believe that the Dechoker is 99% risk-free. We've tried it on ourselves on many occasions, hundreds of times, and we've had no side effects. When you speak of side effects, you must think, have you ever looked up on the side effects of the Heimlich maneuver? There are hundreds of different incidents that can happen using the Heimlich, and there's thousands of things that happen every year that are serious trauma to folks. Also, there's probably 30 to 40% of the people you couldn't pick them up if you wanted to. There's no way you're going to be able to administer it. And if you administer it wrong, you got a problem. Now, we don't say don't use the Heimlich. We just say we prefer to use a less of a risk. We believe ours is 99% risk-free.
The principles behind the Dechoker are simple. The device sucks the air from a patient's airway behind the obstruction, in turn sucking out the debris which has been blocking it. The mouthpiece attached to the Dechoker resembles a traditional oxygen mask, but has an integral tube which is fed into a patient's mouth, which depresses the victim's tongue, allowing maximum access close to the obstruction. Once the mask is sealed around their face, the first aider gently pumps the air out through the attached respirator for up to 3 seconds. This process can be repeated after a brief rest to allow the lungs to reinflate. What seems like such a simple piece of equipment could indeed be the decider between life and death. The Dechoker is endorsed by leading first aid training companies, paramedics, and medical consultants. It is being introduced in first aid training courses across the UK and Europe, and being placed alongside defibrillator cabinets is now regarded as equally important.
If you think that choking is a predeterminant that is one of the causes of cardiac arrest, anything we can do to prevent that has to be good. So part of what we're trying to do is to say to people, look, it's great having a defibrillator in the community. If anything goes wrong, you've got something there to help somebody. But maybe what we should be doing is actually saying, let's try and prevent it from happening in the first place. Now, some we can't prevent, but things like choking you can do something about. And you can do that through making sure that people within the community are aware what to do in the case of choking from the point of view of back slaps and tummy thrusts, but also place tools within the community that actually help address the choking before it even gets to the stage of where they're having to rely on the defibrillator as a point of last resort. So there's a bit of education to do in the community to help them realise that prevention is better than cure. But at the same time, if we could put the tools into the community to help with the cure, much like we've done with the defibrillators, there has to be a big positive advantage.
In the current resuscitation guidelines, it is advised that 5 back slaps are performed first and then followed, if necessary, by 5 abdominal thrusts. This used to be called the Heimlich manoeuvre. Without a doubt, these guidelines have saved many lives, but abdominal thrusts are not without risk. There are many recorded cases of internal injuries where the technique has not been performed perfectly by a layperson and resulted in an accident and emergency admission in its own right. Now, here are a few very important questions. 1. It is inadvisable to perform abdominal thrusts for pregnant women. So what to do? 2. How could a child or a disabled person perform abdominal thrusts on a large adult? 3. How can a partial or fully paralysed care home resident who has, for example, a neck brace, be given back slaps or indeed abdominal thrusts? 4. What about a frail, bedbound geriatric patient? How could they tolerate such forceful treatment with possible osteoporosis? 5. What if it were you who were in a full-blown choking attack? How could you save yourself? Choking can happen to anyone, anywhere, and at any time. The Dechoker solves these problems instantly. Contact Dechoker Europe Limited for any questions you may have, or contact your first aid training company. Most of the leading companies stock the Dechoker. We have an in-house medical consultant should you wish to discuss choking treatments in more depth. Thank you.